Hello, everybody. I see some new faces today. This is so exciting. I'm Debbie Newton. I am the social worker for in Northeast Texas, and Rebecca is our social worker out in, I almost said San Francisco, San Antonio, and Penny is our social worker over in the Austin area. Is it Central Austin?
Yep.
Okay. Yay, I got it. Um, we have a very, very special speaker today. She is one of our TXO social workers as well. And she is at the Mary Crowley, is it Cancer Center Institute?
Mary Crowley Cancer Research.
Okay. And she has over 15 years of patient experience in the healthcare industry. She's also Spanish speaking. She is fantabulous. And today she is going to talk with us about navigating cancer and finances. That's a very important thing to everyone. It increases the stress level and stuff. Hopefully she'll be able to decrease some of your stress about cancer and finances. And after she speaks, we'll have a Q&A, and then we'll be able to talk amongst ourselves as well. So without further ado, Jackie, take it away.
Thank you, Debbie, and thank you so much for inviting me today. My hope is that you learn at least one thing new today, depending on where your families are at in treatment. I know that you've kind of had a huge learning curve in trying to figure out some of these things that I'm going to be talking about today. There it goes. So before I get started, I'm at Mary Crowley. We are part of the Text Oncology, but we're a nonprofit. So our mission is to bring hope to cancer patients through innovative clinical trials while advancing treatment for patients in the future. And so these are going to be the objectives that I want to hopefully cover today. I want to talk about understanding the basics of health insurance. Learning about copay assistance. Because I work with clinical trials and with the patients going on to clinical trial, I'm going to talk a little bit about what that looks like and what kind of out-of-pocket costs the patient might incur. And then understanding how to inquire about work benefits and identifying local and national resources. So let's get started. So before we even talk about all of those things, one thing that I talk to families and patients about that is really, really, really important that a family member or friend help the patient with is that it's making sure that they're signing forms to give family members or friends access to clinics, hospitals, or facilities to be able to talk on behalf of them. And a lot of times you may think that you're having to repeat yourself over and over again when you're going to all of these facilities, like the oncologist, maybe the surgeon's office, the hospital, the lab where maybe they go get their lab work done. And it may seem redundant, but it's incredibly important that because there's multiple companies, multiple people involved, that you're getting authorization from the patient to give you authorization to speak on their behalf, to get information. It's going to be so much more helpful in the long run, especially when the patient's not feeling well, when the loved one is maybe fatigued and just maybe sleeping a little bit more, or maybe nauseous that day and just doesn't have the ability to talk on the phone. If you have already gotten these approvals beforehand, then you can just let them know and you can move on and get the information that you need. This is also definitely important for the patient's job to talk to human resource and insurance companies. Insurance is going to be definitely one of the bigger ones that the patient might be dealing with as they continue on treatment. So health insurance. Everybody has to have it. Nobody likes to talk about it, and it is so confusing. It's confusing for us as social workers sometimes, and we deal with this on a day-to-day basis. And so I can't sometimes even begin to understand how our patients are having to struggle this or navigate through this and having to figure it out. So making sure that you're asking questions is incredibly important. Making sure that it's okay to ask these questions. A lot of times, depending on the insurance plans, they can get very confusing. So I want to go over some terminology that gets thrown around all the time, but you may or may not know what it is. So deductible is the amount you pay for a covered health care service before your insurance plan begins to pay. Copay and coinsurance, these can get mixed up a lot of times. Copay is a set rate, so maybe if it's $20 that they say you're going to pay, that's $20 that you pay every single time you go to a certain doctor. Coinsurance is a percentage of the total charge. So coinsurance typically is 20% or maybe 30%. So you pay a percentage of what is due. The out-of-pocket max and the deductible, my patients tend to get confused a lot of times. So the deductible is what you have to reach before the insurance begins to pay out anything. Out-of-pocket max is the most you will ever have to pay on the covered services for that plan year. And once you've reached this level, it's going to be covered at 100%. If your plan is an HMO plan, these plans require a primary care provider to send a referral to a specialist before a patient can be seen. So these plans, you have to call your primary care provider, have them send a request over to the specialist so that they can be seen. Otherwise, insurance won't pay for it. So it's really important to understand this terminology and these rules. And again, just because I'm explaining it today doesn't mean that you're going to retain everything. Just continue to ask questions. That's really the key for a lot of this information. So I'll give you a scenario because I throw a lot of words out there. So patient A, insurance deductible is $500. The out-of-pocket maximum is $2,000. And the patient has a coinsurance. And remember, we talked about coinsurance is a percentage. So their insurance percentage is 80-20, meaning insurance pays 80% and the patient is responsible for 20%. So patient has coinsurance plan and they've already met their deductible. They have to go get an imaging cost, whether it be CT, PET scan, or MRI, and their cost today is $1,500. But since the deductible has been met, this patient is responsible for 20%. So today, this patient is paying $300. So in patient B, the insurance deductible is $1,000. The out-of-pocket max is $3,500. The patient copay for a specialist is $50. Patient has not met the deductible, but since the plan has a copay, the patient pays $50 for an oncology visit. If additional testing when they visit their oncologist is done, maybe they have to get hydration or they have to get additional labs to see how they're doing, that will be billed on the back end through insurance. And how much will be paid will determine how much they've met with their deductible and out-of-pocket. So different insurances, different deductibles and out-of-pockets will determine how much you pay. So when I get patients that tell me how much it's going to cost, I really have to reference them back to their insurance because it will depend on where they're at with their insurance and what their insurance looks like as to how much they're going to pay for certain things. Explanation of benefits. This is something that when I talk to the patients about and I explain what it is, the majority of the time, most of my patients will tell me, oh yeah, I saw that, I threw away the paperwork, I didn't know what it was or how I needed it. This is incredibly important, and When you're getting started on cancer treatment, a patient can be inundated with a lot of this paperwork, a lot of the explanation of benefits. So if a family member can maybe step in to help kind of navigate some of this and use these explanation and benefits to match them with the bills, it can go a long way to help a patient with the sense of overwhelming feeling of having to navigate and figure out what they actually owe. Why are these things important? Human beings are putting in these codes, and humans are not perfect. They can have errors. And so you really want to make sure that you're comparing this. So how do you read these things? They're all a little bit different. I gave you one that looks a little bit similar to what you might see. You're always going to have the provider name, so that's number one at the top. You see what doctor is being billed the insurance, what date of service. Why is this important? Because what if you were scheduled for a treatment or an infusion that day, and because the patient was too sick, they ended up canceling the infusion and only gave hydration. But what if on the bill of explanation of benefits, you see that they actually billed for treatment instead of just hydration, or vice versa? You want to make sure you're getting accurately what happened that day to be billed. And so sometimes you have to go back and make sure that they did it accurately and they put in what actually happened that day. With family members, if it's something that they want to keep track of, what I've told family to do sometimes is maybe keep track on a calendar. Get a calendar that you can write on. And on today, she went to the doctor, the patient went to the doctor, and today this is what they did, so that you can go back and reference it. Because if you're seeing multiple doctors, this can get very overwhelming very quickly. And you forget day to day what you're doing when you're having to see the doctor so often. The bigger thing with the explanation of benefits is there's a lot of information in the middle about what was billed and what insurance pays for, but what's important is going to be figuring out your share. So in this case, your share is in the gray area, where your total share is $25. So what if I get a bill for this service and the bill from the clinic says I actually owe $50 instead of $25? That means something is wrong, and before you pay that $50, you need to show them the explanation of benefits so that they can get that corrected. Why is it important to speak up? Because if you do not let them know and keep this in mind, and you pay that $50, all the billing and all the money will go to accounting, and they'll eventually find that mistake or that error that you overpaid. But getting that money back can take twice as long as versus you trying to see if they can fix it on the front side. So again, keeping in mind that because the patients are not feeling well, if a family member can help with this and be assigned to kind of coordinate this with the financial office or the billing department, this can go a long way to help, especially because depending on where you're going to, if you're going to see your oncologist, that is one billing department. If you're going to see your surgeon, a lot of times that's another company and another billing department. If you were admitted inpatient into the hospital, that is another bill. And again, so keeping that in mind and keeping track of where you're at with the deductible and the out-of-pocket, you can go back to that person or that billing department and say, I've already met my deductible or my out-of-pocket. Can you please bill my insurance to see what I truly owe? Because a lot of times so many things are happening so quickly that they may not have caught up to what you actually truly owe. And so you can have these conversations with the billing department. A lot of times they are willing to kind of work with you and figuring out, because it does take some time for them to submit the billing to insurance, and that sometimes can be delayed. So if you talk to them, more times than not, they are willing to work with you and figure out if you at least pay this much today, a minimum amount, we'll maybe see if we can bill the rest to insurance so that we can settle it and figure out what you truly owe. So just asking those questions with the billing department will go a long way in kind of figuring out where you're at and how much you do have to owe. So with the longer you're on treatment, especially when you're getting surgery, oncology, maybe radiation, you might want to check with your loved one's insurance to see if they actually have what's called a health insurance case manager. If they do offer that option, this can be very helpful for a lot of different things. This is usually going to be a nurse navigator and or a social worker, okay? So they can help with things like, for example, let's say the doctor's office is sending over an order for a PET scan or an MRI, and for whatever reason, your doctor comes back and say, you know what, it's being held up or it's pending. If this is happening, you can quickly call your health insurance case manager. It would be one person that is going to be assigned to you. So instead of you calling a 1-800 number to figure out what's happening with your insurance, you're going to call that one person who's going to be familiar with your case. You're not having to re-explain everything. And you're going to say, look, they're telling me that this is happening and its insurance is holding it up. A lot of times, because they work for the insurance company, they can help advocate for you and figure out what the situation is. In many circumstances, it seems it's a little minor errors that cause delays. Maybe it's a code that's been input wrong. And because that code has been input wrong, it's pending everything, or it's denying, or it's just getting lost in the jungle. They can also maybe help you figure out what your insurance pays for, especially once that patient has met the out-of-pocket max. Once that patient meets the out-of-pocket max, I usually tell that patient, let's use it until the end of the year, because you are now at 100% and you should not be billed for any additional services. So things that insurance can pay for: physical therapy, lymphedema massage. Some insurances will pay for wigs. You may want to inquire about that. If they do, usually the oncologist can write a prescription for that. Durable medical equipment, if you need a rollator or a walker. And counseling, if you can find a person who accepts your insurance, a therapist. Once you've met your out-of-pocket max, then you can use your insurance and you won't have to pay anything out of pocket. Some insurances have some hidden benefits. I have Blue Cross Blue Shield, and in the Blue Cross Blue Shield plan, hidden deep down inside, there is actually an eye benefit or discount program. And I only found out about it after I went to an ophthalmologist, and they told me that there was a benefit in there where it gave me a discount. So basically what I did, I was paying for eye insurance, and I stopped paying for it because I found out that I'm basically paying for the same thing, and it was giving me just as much of a discount. And I could use my health insurance to be billed for my annual eye exam. So just asking, calling, finding out what else can they help pay for, or if there is anything that they can pay for, what is it that is needed to be able to get it processed. And again, if you have a case manager, they can help coordinate this. They can reach out to the clinic. Especially with durable medical equipment, a lot of times the clinicians may not know what needs to be written in the order, especially once we get into Medicare. Medicare has a lot of rules about how orders are written, and depending on the insurance companies, a lot of them will ask for different information and very specific wording. I have to do a lot of calls depending on the insurance companies and the vendors for the durable medical equipment, because sometimes they are so picky. I've put in all the information and they say, no, you missed 2 words, and because you missed these 2 words, we can't process it until you do it. So it's very nitpicky, and if you have a health insurance case manager that can help you with that so that you're not having to navigate that, or the patient, it can go a long way. So when we talk about assistance programs, or when a lot of my patients are asking for, I need help because these out-of-pockets are so expensive, usually what you're going to be hearing most of the financial counselors, social workers, or nurse navigators talking about is copay assistance. So the copay assistants are organizations that offer to help insured patients that are having difficulty paying for the copays, deductibles, or the out-of-pockets that we were talking about. Most of these programs are usually nonprofit, and their ability to help depends on grants received. While they do help a huge population, because they depend on donations, there are times when they do meet their quota and they have to shut down for a period of time. So they're not always guaranteed, but but the majority of the people do tend to, especially at the beginning of the year, will tend to be able to access these programs. It is based on financial income, and so when I start talking to people about financial, they're like, Jackie, I'm working, I'm not going to qualify. Well, in reality, these programs have very high limits for income, and a lot of people do actually qualify, even if they're still working. So I put in, just to give you guys an idea, for most of these organizations, their income is 400% to 500% of federal poverty guidelines. So for a family of one, their 400% federal poverty guideline would be $51,520. And so you never know, you might qualify, and so it's just figuring out and talking to the financial counselors. On the next page, I'm going to list and talk about the copay assistance companies. But before you go down the rabbit hole of trying to Google all these agencies and trying to call them, use your resources. Figure out who the financial counselor is and the clinics that you're going to, because these copay assistants are typically going to be paying for the chemotherapies or the immunotherapy. So you're really going to be talking to the oncologist office. These programs, there is only one that I know of that pays for radiation. None of the other ones help with radiation, unfortunately. And the only one that does is for blood cancers, and we'll talk about that in the other slide. So you're really going to be focusing on the oncology office. Talk to the oncologist billing department and figure out if they can help you do this. They would send paperwork over to the organizations because there's medical paperwork that has to be turned in. So instead of you doing all that legwork, let them do it so that they can help you get that taken care of, and then they get documentation that it's been approved, and then if it needs to be reapproved, they can also get notification so that if you, for whatever reason, don't get it, they can let you know, hey, it's about to run out, we need to reapply again. The beauty with these programs is that it can be used in combination with your insurance, and it helps to kind of reach your deductible and out-of-pocket max. Why are these important? Well, because in the world of cancer, typically the most expensive things are going to be chemotherapies and infusions. If you're doing those right now, usually within 1 or 2 cycles, you're going to hit your out-of-pocket max because the treatments are so expensive. And so if you can get assistance through the copays, you're going to reach your out-of-pocket max quickly, but they can help you with those. There's also programs for prescriptions. So when you go to the pharmacy and the doctor says, okay, I need you to go get this filled, and you go to the pharmacy and the pharmacist says, okay, Ms. Castillo, today you're going to pay, after your deductible, you owe $500. Before you put that credit card up and pay for the $500, because I know you need, or that patient needs that medication, stop and ask the question. That's expensive. I can't afford that, or that's a lot of money. Is there any kind of assistance that you guys have that I can help with that? If you do not ask, They assume that because you're handing over the credit card, that you're able or willing or want to pay that amount. While it is a lot of money, and assumptions should be made that, hey, maybe they should ask, keep in mind that the pharmacists are not social workers. They're not mind readers. So they assume that if you can hand over a credit card, that you can pay for it and that you're good to go. Ask questions, because you really don't know what might be available. And a lot of times it's as simple as figuring out what the name of the medication is. Is there an alternative that the doctor would be willing to switch so that you can take? So if you can't afford that one, we can't find a coupon for you, is there anything else that the doctor might recommend? It happens all the time. The doctors are very, very aware that not all insurances are created equal. And when we get calls and patients say, hey, Jackie, I can't afford that medication, what are we going to do? If I can't find a resource for them, then I talk to the doctors and they figure out if there's any other options. So asking questions. And then pharmaceutical assistance programs is helping to pay for medications. Going to be, again, chemotherapies, immunotherapies. So this might be a backup if the first two can't offer assistance. So if, for example, the copay assistance programs are closed for your specific cancer, you may be able to reach out to the pharmaceutical assistance companies to see if they can offer any kind of assistance with the medication. So again, these are not a list of all of the programs. These are a list of the major nonprofits that we tend to deal with when we talk about copay assistance programs. The one that I was telling you that has in the past paid for radiation treatment is for the blood cancers. That is Leukemia and Lymphoma Society. All of these in various forms will pay for different kinds of treatments for a specific type of diseases. Also, keep in mind that they are not all specific to cancer. So if you have a patient that maybe has arthritis comes to mind. So if you have a medication for arthritis and it's too expensive, you may want to reach out and see if there's any kind of medication that might be able to help, or any kind of coupon or resource. There's a bunch of different grants or copay assistance based on the diagnosis. And if you actually start looking at these, you're going to find that there's a lot more than just cancer that they can help with. Where I typically would suggest people to start off with, if you don't have a social worker or a financial counselor to help you with, I would usually tell people to go to Needy Meds. Why? Needy Meds is my favorite place to start. Needy Meds, when you go onto the Needy Meds, you type in the name of the medication, and it will tell you if there are any patient assistance programs that might fit your criteria based on the name of the medication. And then they'll redirect you to either the copay assistance programs or the pharmaceutical company itself. You know, when you're calling these companies, even if it doesn't look like you'll qualify, it's always a really good idea to call them anyways and just ask. A lot of times they may have other programs that may not be listed on there that could help you with certain things. Healthwell Foundation, for example, has a program that I think is very underutilized. It has a program for patients who are on cancer, patients who have cancer but are looking for mental health related therapy services. It has a $2,000 reimbursement if you're wanting to go see a therapist or get medication related to therapy services because of the cancer. There's a $2,000 grant reimbursement that patients can access and get reimbursed for any out-of-pockets related to this. That is something that the patient has to initiate. It's not something that you would necessarily find out through a clinic or oncology office. And so just being curious, finding out what is on these websites, what might be available. Healthwell, and actually I think some other agencies, when the pandemic hit, initiated a lot of assistance to help with if a patient lost their job and has to go on to COBRA. It initiated a lot of programs to help pay for COBRA assistance or assisting to help pay for health insurance during the pandemic. GoodRx and RxSaver are examples of some of the prescription assistance programs. GoodRx, if you type in the name of the medication, it's going to pop up with pharmacies closest to you, and it actually will compare the prices. So if you go to a Target versus Walmart, you might actually notice there is a difference between what you're going to pay on these prescription medications that they prescribe. And sometimes there is quite a bit of difference. And so if you want to just try to compare it, GoodRx is one of the major ones, RxSaver. There's a lot of other ones. With these prescription assistance programs, what you have to keep in mind is that if you choose to use these programs for your medications that you go to fill at the pharmacy, you use these prescription discount programs instead of your insurance because they have negotiated a set rate, and so that is kind of like using their insurance to get their medication. So I mentioned I work at a facility that we work with clinical trials. We only do clinical trials here. And so I get a lot of patients and a lot of people that have a misconception of, a lot of people think that everything 100% is paid for when you go into clinical trials, and that is actually not true. And so I want to talk about that because that's really important if you ever are interested in, or a patient is interested in participating in a clinical trial. So typically, the sponsor, and when I say sponsor, I mean pharmaceutical company or the person or the company that is investigating the drug. The sponsor typically will pay for the drug that is being tested. So usually the chemotherapy or infusion or the pill that is being given, that is being paid for by the sponsor. If, for example, there's additional testing that has to happen outside of what I call standard of care. Standard of care is stuff that has been approved by the FDA for treatment of cancer. So chemotherapies, infusion, hydration, lab work, all of that is called standard of care. So a lot of my clinical trials require eye exams. That is not normal for cancer patients or cancer treatment. Sponsor pays for that. Some of my trials require to go see a cardiologist and get approval or clearance to move forward with the trial. That is not normal, and so sponsor pays for that. Sponsors sometimes on clinical trials, especially in the earlier phase, may pay for hotel and mileage. And so it's always really important, if this is a concern, you always ask wherever your site that you're going to for clinical trials, because you never know what might be available to get you reimbursed. So what does the patient pay for? Patient will pay for standard of care. So things that typically would happen at your normal clinic, you would pay for through your insurance. One of the other things that patients will say, well, is my insurance going to pay for it while I'm clinical trials? Yes. We usually don't ever have problems with insurance paying for what we consider standard of care, because these things have already been approved and normally happen at your normal facility. So if you have to have hydrations, if you have to have normal lab works to see how you're doing, any office visits to see a provider, any imaging like CT scans, PET scans, if you have to go to the hospital because you're not feeling well, those are things that the patient would be billed for through insurance, and they would be responsible for. And again, patients may ask me, well, how much is that going to be? Let's go back to your insurance. It's going to depend on how much what your insurance looks like, what your deductible is, what your out-of-pocket is. What I will tell you in general to keep in mind with my clinical trial patients is that they're not going to hit their out-of-pocket max as quickly as the patients who are on standard of care. Why? Because the most expensive thing is the immunotherapy, chemotherapies, and in this case, the sponsor's paying for that. So usually it takes a little bit longer to hit that out-of-pocket. So work benefits. I'm going to talk a little bit more in detail about some of these. It is so incredibly important that when a patient is in treatment, that they have a conversation with their human resource department and figure out what benefits they actually signed up for. If I poll an audience, 9 times out of 10, most people will tell me, yeah, I signed up for insurance, but they don't know what other benefits they signed up for, and they don't remember. They don't, because they're not using them on a day-to-day basis. I'll give you a scenario. I had a patient who worked at a big box chain shopping center, and he had his insurance, and he was using his insurance, and I kept telling him, I said, you need to go talk to your HR and figure out what kind of resources you have, what kind of benefits you have. He finally went and found out that he had actually signed up for a supplemental cancer policy that he could have activated since day one. He finally was able to activate the policy, but he had been struggling all this time, and he found out that because he signed up for this policy, he was able to get, I think it was like close to $5,000, just a check that got cut to him, and he decided how he wanted to use it. And his insurance actually had a benefit where he would be connected to an insurance cancer expert, and they were able to fly him to New York to get on a clinical trial. They paid for his hotel. They paid for all of his mileage. They paid for any out of expenses for meals, and they paid for. He had already met his deductible, so everything at that facility was paid for. He did not know, and unless he had asked, he would have never used these resources. Time and time again, I get too many people telling me I didn't ask. So always ask and figure out what you sign up for. A lot of companies, especially the bigger the company, may have a pool or a sick leave that you may be able to access. So find out what the benefits are within that company. So short-term and long-term disability, not to be confused with Social Security disability. These are plans, think of them like your Aflac plan or your MetLife plan. You have to sign up for these plans. Sometimes they're automatic with the companies that you sign up for. So depending on your job, sometimes they automatically sign you up for them and they pay for the services. Sometimes you have to pay for them and you have to sign up for them. If you do have these can help. So you're out of not working because of the cancer. They can be active while you're for Social Security disability. Social Security disability is the federal program that one would apply for if they have a disability process. So as you can see, it does pay a percentage. It's not going to pay 100%, but it will pay a percentage while the patient is out of work and they've exhausted their leave and sick time. These plans are a little bit easier to get them activated. Usually it's just having the doctor fill out medical paperwork to let them know that because of their illness and the fatigue or the side effects that they're experiencing that they need to be on this disability. Family medical leave. This applies not just for the patient, this applies for the caregiver as well. I think a lot of times my caregivers forget that they can use this. Immediate caregiver, so spouses, siblings, and then children or parents can activate these plans. So it entitles eligible covered employees, and we'll talk about who is eligible and who is covered, to take unpaid job-protected leave for specified family and medical reasons. It is 12 weeks in a 12-month period, and it can be either continuous or intermittent. Especially for my caregivers, they may need to take intermittent because they're not going to need to be off every single day, so they can pick and choose. This is really important, especially for caregivers if they have a job where it's really hard to take time off. Once family medical leave is activated, they really can't question why you're taking off. They can't say, well, Jackie, I need you to be here. If you have family medical leave and it's been approved, you are able to take leave when you need to take leave to be there for your family. And it's job protection. It protects your job during those 12 weeks. They really can't do too much during those 12 weeks because it is a federal law that protects your job. So who is eligible? You have to have worked for the employer for at least 12 months or have at least 1,250 hours of service during the 12-month period. You have to work at a location where an employer has at least 50 employees within 75 miles. So bigger companies. A lot of the smaller companies don't have to offer this, but even if they don't, you want to have a conversation with them and be upfront and say, this is what I need. A lot of the smaller companies I find are willing to work with the families, especially if they're very upfront about what time they're needing or what that looks like for them. Who is covered? So again, 50 or more employees in 20 or more work weeks in the current preceding calendar year. Public agencies, local, state, federal, regardless of the number of employees, have to offer it. Public or private elementary schools, regardless of the number of employees, it has to offer these. So life insurance. I always try to mention this because there are some things that you may want to inquire about. So if a patient has an insurance through their job, and they're in the process of maybe having their FMLA being expired, they may want to have a conversation with the HR to see if what that insurance looks like that they signed up for. Is it something that they've been paying extra because they had a bigger benefit off of it? I had a patient that actually did get a really high plan, and that he was about to be terminated. And he didn't want to lose it, because once you terminate from that employer, you lose that benefit. But he contacted Human Resources, and then he contacted the life insurance company directly, and he was able to continue making payments to that insurance company so that he could keep it once he terminated from his job. So, especially if you've been paying into it for many years, or you've been with that company, it may be worth the benefit to try to check in and see if you're allowed to continue to pay for it, and keep it after you've been terminated. There are certain riders that some of the policies may have. Riders are basically additional benefits that can be bought or added to the basic policy insurance. Some of the jobs will actually have these riders added on, and so you have to find out what riders the insurance policy may have. There is a disability waiver premium rider where it covers the premium if you meet the policy's definition of disabled. The rider is usually available to people younger than 60. If you have this rider, then you don't have to pay any more premiums, and the policy will continue to stay active. Accelerated death benefit rider. It prepays for all or some death benefit while you're living. You must have a terminal illness, specified disease, or long-term care illness. So if you maybe have a loved one who has advanced cancer, and they are running out of funding and they want to access this, they can contact their insurance company and see what documentation might be needed to try to access this money while they're still alive and still doing treatment. So non-medical financial resources, these can be anything like gas card, transportation vouchers, rent, utility assistance, food assistance. So these are not, usually resources are not going to be listed because of the cancer that you have. What I tell people is if you need this help, talk to a social worker, talk to a nurse navigator before you go down this rabbit hole of asking or trying to do it on your own. This list, if you call general agencies, can be very exhaustive and can be at times overwhelming to try to find on your own. A lot of the social workers usually have a shortcut list and say, hey, this might be a better one to try, you might do this one. Because a lot of these agencies are nonprofits, they depend on funding from the government or local agencies, and so sometimes they open and close their resources. If you are looking for anything cancer related, you can always go into the Cancer Financial Assistance, and sometimes it lists them out based on cancer. If you are looking for local resources to help pay for things like rent, you might want to check with the social worker or nurse navigator to see if they can connect you to local resources that don't necessarily have to do anything with cancer. in the copay assistance, I talked about the organizations that help with copay, but sometimes they close their funding. If you go onto Fund Finder Pan Foundation, they've created a website where you can register your name, your email, and the diagnosis that you have. So if there's no copay assistance at that time, you can register your information. And the minute that any of the major organizations open up funding for that specific disease to help pay for chemotherapy or immunotherapy treatments, it will alert you via email or text or however you decided to benefit. Why is that important? Because I have had situations where one day it's been closed for months and months. They open up one day, and then one day they're closed again because they have so many people calling in. And so if you get activated and you get registered and are notified, you can be one of those people that calls in and gets approved so that you can get that assistance. If you want any more information about clinical trials, this is information about where to go in general. And that, I gave you a lot of information. So any questions, comments that you have?
Does anybody have any questions, or are we in information overload? Well, Jackie, I think everybody's in information overload right now. So if you do end up having some questions, let us know, and we can get the answer. We might even have the answers, or we can ask Jackie for further answers as well.